So this is Katie Danielson, and this part of the presentation is about Dr. Bruce Perry's neurosequential model of therapeutics. Children who have undergone trauma may have neurodevelopmental problems of different types. These problems may include sensitization of the neuroendocrine stress response, glucocorticoid resistance, increased central corticotropin releasing factor activity as a response to stress, dysfunctional changes in the HPA axis, and that is the hypothalamus, pituitary, and adrenals. And basically, in a way, what this boils down to is very simple. It's the fight or flight stress response being activated in response to day in and day out stresses, which is not supposed to be happening. The fight or flight response is very useful if you're running from the tiger, if you're fighting the wolf. But when it is applied to everything, it is very dysfunctional. And this can lead to things like abnormal immune activation later in life, which could contribute to being a source of autoimmune disorders being a lot more common among adults who have been traumatized as children. Severe depression, PTSD, and dissociative disorders have all been directly linked to these neurobiological dysfunctions. Children with these neurological issues may then show a wide range of problems in the emotional, behavioral, cognitive, psychosocial, and physiological realms. The neurosequential model integrates essential ideas about neurodevelopment in traumatized children into a real-world clinical approach that directly addresses meaningful therapeutic work with these children and their families. Three core elements of the model are a thorough understanding of developmental and relational history, a detailed assessment of the current level of functioning, and personalized recommendations for the most effective evidence-based interventions for the individual situation. The NMT core assessment plots a brain map based on key negative events and environmental traumas and when they happened, and the current level of functioning of the child. This map helps to determine the right interventions and enrichments to help the child get back on track. You start with the most basic level of problems mapped into a lower area of the brain, like the limbic system, which is right there. And you might use somatosensory interventions such as dance, music, and movement. Then you move the interventions up sequentially in areas associated with higher brain functioning, such as the prefrontal cortex. And that's when something like cognitive behavioral therapy may actually start to be useful. Early intervention and effective therapeutic services are key, such as infant mental health, home visitation programs, high quality childcare programs, and effective early childhood education programs. Healthy and positive relationships can mediate childhood trauma with caring adults and with peers. The ideal situation for neurodevelopmental health for a child is for children to live in an environment that is both positive and predictable, without chaos, fear-inducing caregivers, trauma, abuse, or neglect. The model has been used in various ways in a wide variety of settings for children, teenagers, and adults, including therapeutic preschools, early Head Start programs, infant mental health, residential treatment centers, schools, private and outpatient clinical practices, and also to guide clinical decisions in child protective services and child mental health settings. NMT training and certification programs require a minimum of 90 hours spent in classes, clinical case presentations, reading materials, and multimedia study, among other things. In conclusion, the neurosequential model has been shown to be effective in producing positive outcomes for traumatized children. It directly deals with traumatized children at an earlier stage of their lives, and its structured, individualized early intervention can interrupt the destructive cycle of the after effects of neurodevelopmental trauma and may prevent severe and ongoing problems later on. So in conclusion, this has been the presentation about the neurosequential model.